prevalence of medically unexplained symptoms in adults who are high users of healthcare services and magnitude of associated costs. A systematic review. Medically unexplained symptoms, or MUS, is a common clinical syndrome in primary and secondary healthcare service. The aim of this study was to determine the prevalence of MUS in patients who are high users of healthcare or high-cost patients in comparison with routine users and the magnitude of associated costs. Researchers conducted a systematic review of databases for studies investigating adults aged 18 and above who are high healthcare users or accrued high healthcare costs, in which the prevalence and/or associated costs of MUS was quantified. 25 studies involving 30,000 patients were included. Researchers reported that due to high risk of bias and heterogeneity between studies, results are described narratively. There were wide variations in prevalence estimates for MUS in high users of healthcare, but MUS was more prevalent in high-use groups. 3 studies reported greater healthcare costs associated with MUS. Researchers concluded that MUS has been found to be more prevalent in high-use healthcare populations than comparator groups, but the magnitude of difference is difficult to estimate due to considerable heterogeneity between studies and potential for bias. Future studies should prioritize a standardized approach to this research area.